Welcome to Trending with the Tribune, and I am June, your host of Let's Talk, all things business, speech, and motivation. And it is an exciting time for Nashville. We have an election coming up. That's right. We have a special election coming up as it is time for the voters and the community of Nashville to select the mayor. And today my special guest is Mayor David Briley. He's the acting mayor of Nashville. He was elected as vice mayor in 2015 and sworn in as the acting mayor of Nashville in March of 2018. Mayor Briley is a lifelong Nashvillian and a dedicated public servant. Sir, welcome to Trending with the Tribune.
It's great to be here today. It is.
Thank you so much. The statistics show or indicate that Nashville allegedly had quite a few schools in the lowest 5% of all schools in the 2016-2017 year in regards to performance scores. Now, as mayor, a lot of people would be interested in knowing what would you do to improve these numbers, and how would this initiative be funded?
So I'm a strong supporter of Dr. Sean Joseph, who is the director of our Metro Nashville schools right now, and he has focused a lot of effort on literacy. We have only about a third of our kids in third grade who are reading at the appropriate level, and we know that that results in a lot of those young people not ever graduating from high school. A high school graduation is really what's absolutely the bare minimum to be working in our community right now for the jobs that are coming online. So we got to make sure everybody has a chance to graduate. So literacy is the number one focus of what we need to be working on. Dr. Joseph has some good plans and programs that he's trying to implement. And although this year we didn't have any new money for Dr. Joseph at Metro Public Schools, I'm going to work to make sure that in the coming years we give him additional resources every year. One of the problems this year as well is we lost some money from the state. The state is giving us less money every year to spend on our public school students, and so we're going to have to step up to the plate locally and find some more resources for Dr. Joseph to use.
Okay, now DACA, considering we are talking about education, it is known that the previous Nashville mayor, she was among over 100 mayors of a group that was urging President Trump to continue this federal program that protected undocumented immigrants who entered the U.S. illegally as children. She was part of a group that wanted the president to continue to allow them to work, go to school, and to protect them from being deported. What is your current position on DACA?
Well, I agree that if a child is brought here by their parents when they're 2 years old and this is the only place they've ever lived, that it's not the Nashville way for us to deport them back to a country they don't know. So I'm in favor of extending the DACA program. I think the courts have already done that to a degree, but I think we need to have a comprehensive approach to immigration too. I think DACA is just part of it. We need to make sure that we have good people coming to the U.S. We have borders that are protected, but we also are aware of the fact that we do have a lot of young people who came here through no decision of their own and are doing well. There are lots of nurses and people in the military and police, and we've got to make sure that we be a welcoming place to those young people.
In regards to a welcoming place, a lot of Nashville residents may not understand what happened in the Tennessee House in regards to the sanctuary cities and how it works. Well, the Tennessee House approved a bill, and there was a vote, 64 to 23, that banned Tennessee, let's say Nashville, in regards to being a sanctuary city. As a mayor representing Tennessee, how will you influence immigration reform policies?
Right, so the legislature had, I think even last year, had passed another bill that prohibited us from being a sanctuary city. So Nashville is not a sanctuary city, and that's not on the horizon for us. all I can do really, immigration is a national policy. And the federal government has to set that policy, and they, it seems that very little happens in Congress anymore. Not since, I guess the last big thing was the Affordable Care Act, one of the last big things that has happened in our country from Congress. And so I'll step up and I'll call it like I see it and try and get Congress to take some steps and to do their job and fix our broken immigration system. In the meantime, it's our police tell us that some of the fear of immigration enforcement makes it harder for them to enforce the law. So if you have a set of circumstances where a witness to a crime might fear deportation if they report the crime, that's just not good for the community. So we need our police to be able to go out and do investigations and enforce the law without people fearing that they're going to be immigration agents too. So I listen to our police department in that regard. So we're not going to be a sanctuary city, but we also want to give our police every tool they need to enforce the law.
Now, I heard you mention the Affordable Care Act, and so that leads me to think about people that may not have access to health care and people that are in underserved areas. So that takes me to Nashville General Hospital. Now, the former mayor, she was going to end the inpatient care at Nashville General Hospital, but I understand that you are committed to keeping it open, although there are financial struggles, and that's understandable. So at this time, what is your vision for Nashville General Hospital?
So this year in the budget, we included sufficient funding for them to operate this year without coming back to the council to ask for additional funds like they had to do last year. And I spoke as recently as last night with Dr. Webb, who's running the hospital, and he informed me that he and Dr. Hildreth at Meharry are working hard on some plans to improve the efficiency of the hospital, so that the amount of money that they got this year would be the maximum they would need. They might actually need a little bit less as we go forward, as they find ways to more efficiently operate the hospital. But I'm committed for as long as I'm mayor to make sure that we have a safety net that's adequate and for people who don't have health care. It would be great if the state would expand Medicaid as they're allowed to do under the Affordable Care Act, because it would get, I think there's 40,000 people in Nashville who would qualify. But until they do, we'll continue to provide the kind of care we're doing right now at General Hospital. I think I'm going over there in the coming days to shoot a video in support of the hospital. So.
Medical marijuana.
Mm-hmm.
Now, it's been made legal in many U.S. states and, of course, some territories. And the medical experts have proven that medical marijuana prevents seizures and helps with anxiety disorders and, of course, assists some patients with pain. Now, as mayor, what position do you take on the use of medical marijuana in Nashville?
Well, it's going to be up to the state to decide that we can do it or not. So I'm really a voter on that one. I'm just like everybody else in the city. As a voter, as a citizen, as a person living in this town, I wish the state legislature would go ahead and follow the lead of, I guess, the majority of the states in the country now, probably allow it. And I think people have seen that it is helpful for certain people with certain medical conditions, for sure. I think there is some sense that it might play a role in helping us deal with the opiate crisis as well. So I think there are plenty of reasons for us to go ahead and do it.